Do you think physicians want to see cost when considering aspects of care in the equation while treating their patients?
I mean, I'd say never more so than now. Again, if you think of COVID as a catalyst and ripping that Band-Aid off, the current economic/financial pressures on hospital systems are opening everyone's eyes to the cost of care and then the impact to down the line for them. And so I'd say now more so than ever, you have their attention for that.
I think from my side, I think physicians or clinicians are moving towards a broader value-based equation for care. Now, what is value? Value is quality plus experience divided by cost. So I think to just think about something as quality being a high-priced, high-end care, you have to think about the whole value equation, particularly given the cost sensitivities and everything. Now, couple that with what's happening in the backdrop of price transparency, surprise billing, all those kind of things. There is a huge patient liability. There is a huge liability for healthcare systems, hospital systems to bend the cost curve. I certainly was on the bandwagon of cost of care to be highlighted for clinician way back when, 2014 or something like that. And I'll just share this quick aha moment for me. I was doing my hospitalist rounding, and it was a patient I'd been taking care of 3-4 days. On day 4, the patient had been, I think, around there for 8 or 9 days, but that was my day 4 patient. Pharmacist comes running to me and says, Dr. Vashist, I'm sorry to bother you, but you're giving this particular medicine to this patient for lowering her calcium, and this costs $10,000 a day. And I'm like, day 8, 9, I've already almost $100,000 just for one medicine and counting. Who's paying for it and everything? And I'm like, this is unacceptable. Because here's the thing. Now, you have to separate this discussion from the fact that sometimes it is felt that clinicians do not want to talk about the costs of care. Let me reshape that argument. We can always talk about the costs of care as long as those are highlighted to us in real time, not retrospectively. I'm not going in my rounding, or any other clinician for that matter, thinking that I'm going to rake up $10,000 in costs of care today. It is what is happening. My awareness is not there with real-time data. So how do you address that pain point in a seamless, invisible way that makes it apparent for clinicians and help them be a part of the team that bends the cost curve while maintaining the quality of care? I think that is a salient issue to consider.